Check your state laws and facility policy to make sure you are permitted to perform this procedure. Before serving a meal tray, check the care plan or the nurse's instructions. Note any restrictions or special considerations. Before you begin, practice hand hygiene. Identify the patient and make sure that privacy has been provided. Follow all additional instructions in the preparation section of this program. Before serving a meal tray, provide for privacy.
Hello, sir. How are you today?
Just fine.
My name is Ellie. I'll be your nurse assistant.
Okay.
And what's your name?
Kent Davis,
And what's your date of birth, Mr. Davis?
8/4/45.
Okay. It's coming up on lunchtime. Are you hungry?
A little, yes.
Okay. Well, we'll get you set up to eat some lunch.
Thank you.
I'm going to position the bed, if that's all right.
To prepare the person for a meal, first make sure eyeglasses and any hearing aids are in place.
There you are.
Next, while wearing gloves, assist with oral hygiene, as shown in the video skill performing oral hygiene. If the person wears dentures, make sure that they are in place. After removing your gloves, practicing hand hygiene, and putting on new gloves, assist with elimination, as shown in the video skill giving the urinal. If the person is incontinent, make sure that he's clean and dry. To continue, again remove your gloves, perform hand hygiene, and put on new gloves. Then assist with hand washing. Afterwards, remove your gloves and practice hand hygiene. For a person who will eat in bed, raise the head of the bed to a comfortable position. Then remove items from the overbed table and clean it. When the table is clean, adjust it in front of the person.
How does that work? Is that too high for you?
No, that's fine.
That's good?
That's fine.
All right.
Hello. Hi, my name is Cindy. I'm going to be your nurse assistant today.
Okay,
Can I see your ID, and
sure.
now can you tell me your full name and date of birth?
Anne Reyes, 3/14, 1935.
Good. Okay, thank you.
For a person who will eat in a chair, position her in the chair or wheelchair. Then remove items from her overbed table, clean it, and adjust it in front of her. Or for a person who will eat in the dining area, assist him to it. To serve a meal tray, make sure the tray is complete by checking its items against the dietary card. Also, make sure it includes any assistive devices that the person needs, such as adaptive eating utensils. Then identify the person, checking his ID bracelet against the dietary card, and calling him by name. Assist the person with the clothes protector as necessary. Make sure the tray is within the person's reach. If needed, adjust the overbed table. After removing the food covers, open cartons, cut food into bite-sized pieces, butter bread, and prepare other items based on the person's needs. Season the food as he prefers and as allowed on the care plan. Next, place the napkin, eating utensils, and any assistive devices within the person's reach. Also place the call light within his reach.
If you need anything else at all, just use your call light. I'll be back in as soon as I can, okay?
Okay, thank you.
You're welcome. How was your meal?
It was all right.
When the person has finished eating, put on gloves and check for and remove any food left in the person's mouth. After removing your gloves and practicing hand hygiene, remove the tray.
Sir, I'm gonna go ahead and take your tray out of here, and then I'll be back to get you cleaned up.
Okay, thank you.
You're welcome.
Clean any spills. And if the person's linens or clothes have become soiled, change them. Measure and record the person's intake, if ordered as shown in the video skill, measuring intake and output. Note the amount and type of foods eaten, and make notes on the flow sheet.
Okay, Miss Reeves, I'm going to go ahead and help you walk back to bed.
If needed, help the person return to bed.
Good. go ahead and sit. All right, let me help you with your slippers.
To complete the procedure, put on gloves and assist with oral hygiene and hand washing. Afterwards, remove and discard the gloves and practice hand hygiene. After serving a meal tray, perform post-procedure care. For example, position the person for comfort and in good alignment. For detailed information, see the section on follow-up care, reporting, and recording in this program.